I'm just going to go through an analysis by the Upshot at the New York Times of deaths amongst African Americans in 2019 in the United States. So what you're looking at here is a bunch of dots. Each of those dots represents 10 people, and this is roughly what you would be looking at if Black Americans had the same mortality as white Americans. So each of these dots represents 10 people. Now, imagine that we reorganize these deaths by age. Here we see that around birth there's a lot of deaths. That's infant mortality. And then deaths remain really low throughout childhood, and then they slowly increase throughout life. They start to exponentially increase after the age of 50, and then the population starts to die off after that. Okay, so that would be the number of deaths that we would expect if Black Americans had the same mortality as white Americans, but they don't. So this red area represents the excess mortality amongst Black Americans. So this is the health disparity in mortality for African Americans in the United States. In 2019, we would see 72,000 more Black Americans die than would be expected if they had the same mortality rate as white Americans. That's represented in this red area. So this black area here shows that there's actually lower mortality after, around the mid-80s. Why is that? Well, it's mostly because of this excess mortality in here. What that means is that this population has been exposed to an increased risk of mortality, and only the most hardy survivors remain into old age. So mortality rate actually looks lower later in life. In total, that adds up to over 355,000 Black deaths, 1 in 5 of which happened earlier than expected for white Americans. The population most severely affected in this group are babies. So infant mortality rate is twice as high amongst Black infants than amongst white infants. Now, why is this? Well, there's two reasons. One is that there's a history of racial discrimination that's affected the economic well-being of Black Americans, and as a result, Black Americans tend to live in poverty at a higher rate than white Americans, and tend to live below the median income at a higher rate than white Americans. A second reason that's independent of that is that it is stressful being a Black American in the United States. As a result of this stress, you see higher levels of cortisone. Now, the stress response was really designed to help us avoid prey. At the dawn of human civilization, we had to worry about lions and tigers, and cortisone helps divert energy from all the cells in the body into the thigh muscles so we can run and get the heck out of there. The problem with that is that if it's chronic, it can cause wear and tear on all the organ systems in the body. We're basically diverting energy from the brain, from all the other organs in the body, into the thigh muscles. So what does that do? Well, it causes wear and tear on the body that causes premature aging. And this you can see very clearly here in this red area, where excess mortality occurs at a much earlier age than we would normally expect.